Welcome everyone. Today we have our another new episode and we will discuss very important aspects. We will discuss on AI in healthcare. We have our honorable fellow Dr. Tamanna Khoshla. Dr. Tamanna, my first questions to you: what are the primary applications of AI in healthcare today?
Yeah, Dr. Shri, thank you for having me. Yeah, AI has been a hot topic and has captured a considerable amount of time from the medical fraternity. I mean, it's an exciting times for medicine right now because we are venturing into an area where we can resolve many of our diagnostic and many of our uh, correct treatment spans. When it comes to healthcare, AI is already actively being used in this industry on a smaller level, but there are various factors that prevent large scale automation also that we are going to discuss over the period of time. Things like diagnosing patients. AI algorithms analyze medical imaging data such as X-rays, MRIs, and CT scans to assist healthcare professionals in accurate and well diagnosis, swift diagnosis, transcribing medical documents. Automatic speech recognition technology employs advanced algorithms and machine learning models to convert spoken languages into written text, providing a more efficient and accurate method for documenting medical drug discovery is another area which is of crucial importance. The pharmaceutical industry is majorly relying on it for example, diseases like cancer, which are like very difficult to not just detect but also to cure. Um, so these are some of the challenges which are being faced by AIDS, for example. Africa is under the spell of this particular disease. So drug discovery and development, AI accelerates the drug discovery processes by analyzing vast database to identify potential drug candidates and predict their efficiency. So the prediction is something which is now we are relying on robotics. Administrative efficiency. AI streamlines administrative tasks such as billing and scheduling, reducing paperwork and improving overall operations efficiency within healthcare organizations. So each of these uses are done through different AI technologies, as AI is not one technology but rather a collection of them. For example, examples of AI technologies would be like machine learning, one of the most common form of AI that is broad technique of core of many approaches to AI. Neural network. That's again, the SpaceX, Elon Musk is into this thing. Type of machine learning that is more complex than traditional machine learning. Deep learning type of machine learning that is the most complex form. Natural language processing enables a computer to interpret and use human language and include two basic approaches, statistical and semantic. Where is AI going in healthcare? AI has already played an important role in healthcare, and it has a very bright future ahead, and it is positioned to improve patient outcomes, increase safety, reduce human error, and reduce costs associated with healthcare, along with many other opportunities and changes in career programs. According to National Library of Medicine, I was reading an article on that, and I'll quote from there. We expect to see limited use of AI in clinical practice within 5 years and more extensive use within 10. Several key directions indicate where AI is heading in the healthcare sector. A few include enchanted diagnostics and personal treatment, analytics for disease prevention, to drug discovery and development. This is an extremely important area which we need to discuss and deliberate as much as possible. And I feel that people who are from philosophy background, etc., should make the basics of look into the basics of healthcare, and how AI can contribute to a better healthcare system, in disability, for example, and how a disabled person can take proper help from robots and have a world whereby disability is not some is actually a disability, but it might just be a better ability to look at things differently, and that would come to fore.
Thank you. My next question for you: how does AI improve diagnostic accuracy and efficiency in the healthcare setting?
Yeah, so I guess diagnostics, as far as is concerned, I mean, when robotics and AGI and AI, etc., are they venture into this particular area of diagnosing a disease, be it a small disease or a big disease, it's a problem to the patient. So whatever it may be it a normal headache, or be it a brain tumor, or be it Alzheimer's. Many of these diseases are so debilitating that people are unable to function properly because of these diseases. So I guess we need to venture out. We need to have more of the movies like that. Positive movies whereby we are able to cure these diseases. As of now, we are unable to. Western countries are still more capable, but developing countries are still facing problem of cancers, and millions of cases are there where people go untreated, or even if they're treated, their whole properties get sold. And it's a very sad scene, in, for example, in US or UK, as far as cancers are concerned, they have specific um, hospitals dealing with specific diseases, or symptoms. But that's not true in India, for example, or Bangladesh, or any of our South Asian neighbors, friends. And that is what we really need to work on. And we have to have our brains coming together for something like this. People are really troubled. South Asia, for example, we have a major risk of heart diseases and blood pressure. So AI has to look into these smaller, which are like which which leads to problem in living a proper life. So we need to have like systems and medical systems whereby we may have right kind of diagnostics, as well as right kind of medicines being given. Thank
Thank you. My next question for you about ethics. How can AI be integrated into ethical healthcare system without disrupting current workflows?
Yes, actually, as far as COVID, yeah, I mean, I like to quote COVID for this thing. I mean, many of these Chinese hospitals, for example, had spurious drugs. Similarly, Germany also was under that problem. And many of these pharmaceutical industries are extremely, what do you say? I mean, they're like a mafia. I mean, that's the mafia which they're operating, because they're working in millions and millions of dollars. And that's a huge problem. So the governments have to intervene as welfare states, and have specialists who look into the the mafia-hood of these pharmaceutical industries. And I mean, the way the terrorists are there, for example, this is a different kind of terrorism, which is like which leads to people being killed. Chemotherapy, for example. I mean, why can't we have a better system of treating a certain disease, whereby people are unable to live a proper life? So I mean, it's said that they are doing it deliberately, so they're not able to come out with the right kind of diagnosis, and the treatment of this person, the patient. So I mean, we have to set up not just the social structure whereby people having certain diseases are able to kind of come out of it, and come out of depression, of having a serious disease, and are able to live a full positive life.
Thank you. What are the ethical considerations associated with the use of AI in healthcare?
Yes, I just said right now, I mean, ethically speaking, people should, doctors and doctors should be more patient towards patients. I mean, for example, I mean, I just don't know about the worldwide system, but like in India, doctors are extremely rude and always busy. They seem to be busy always, and like they're like minting money, but they kind of give that cost to the people, the patients, for example. So ethicity of religion of healthcare system is a must. And as far as the ethics is concerned, people have to understand that, I mean, this healthcare is a problem today, tomorrow, and for the coming future. And it's not going to go so easily. So we have to have a right kind of agriculture. Pesticides have to be reduced. Many of the things together have to be done. And AI can help in the farming sectors. For example, the kind of food we are getting. For the food we are eating is full of pesticides. So AI can resolve that problem, whereby these drug causing foods can be done away with, and organic foods which are lower in cost rather than expensive. We have to reduce the cost. That's the whole problem. We have to reduce the cost, and we don't have to be a money centered society. We might be money centered. It's okay to earn money, but like, as much as required, we have to take care of our middle and the poor classes who can't afford health care. Yeah.
Mhm. Thank you. What is the potential impact of AI on healthcare cost and accessibility?
Yes, I guess, as far as it's like advantages of AI healthcare is concerned. It improved diagnostics, and it leads to precision in medicine. So costs are deliberately reduced. But as far as the bigger diseases are concerned, the more dangerous diseases are concerned, still we need to delve more into the whole structure, and have a system whereby these medicines are not expensive, and just don't make money out of somebody's misery. That's what I would like to say. And like, and the cost should be reduced majorly. Yeah.
Thank you. What's your closing remarks for today's session?
Yeah, I'll just like to say that, I guess every human being has a right to be happy and disease free, and that basic thing should be there. The focus of all our philosophy should be that, we have to grant happiness to people, and that's only possible when we are healthy. And so AI, I hope in future we develop it to such an extent that, all diseases are able to be done away with, and all humans, irrespective of the class, caste, gender they belong to, are able to access healthcare.
Thank you. Thank you for joining today's sessions. And I request all of our audience, please share our content as much as possible. Thank you. Bye bye and take care.